I first heard about Arina from my YMCA coach, and I was told about someone with magic hands that does diagnosis of the kind of aches and pains and injuries that we get so often. And I've gone to Arina now, and my girlfriend Trudy has gone with me to Arina now for several months, and we've had remarkably good results. Arina came from Russia, and she had training in Queens College. She had undergraduate degrees in biochemistry and psychology, and earned her doctorate in physical therapy from Truro University.
Truro, yeah.
Originally from the Soviet Union, and she's lived in New Jersey for the last 7 years. Before that, she treated kids with disabilities in the inner city public schools. In 2006, she opened her own general practice, and her husband's a radiologist. And when he had took a job in New Jersey, she decided to open her practice, Central Physical Therapy in New Providence, on Central in New Providence. And she also has a physical therapy educational video company, POSTOP, postopyoga.com. And let me ask her to tell us her story then. Arina?
Yes, hi everybody, it's me. I never spoke on Zoom, I'll be honest with you, that's my first experience like this. I had televisits with patients one-on-one, but I never had this kind of experience. So please forgive me if I get a little bit off. So like Peter said, I came from Soviet Union at the age of 20. So that's why I said I can't tell a lot about social medicine. Grew up there, and I really appreciate this country more than probably people who born here, because we were able to work for something that we would never have in other country and accomplish it. So I'm very proud to be a part of this country, and always feel like home in this country, which I know in other countries as an immigrant, you can never feel home, no matter how well you speak the language or how far you accomplish. Have a practice, a small practice, not a big one, but always was proud of what I do. Had practice in New York as well, always was proud of what I did, and worked with kids with disabilities parallel with my practice. I still see some pediatrics. I do sometimes fly to Boston for consults for pediatrics as well, for families who cannot afford expensive pediatrics evaluations. So it's purely with Kids Link practice in Boston they do as a charity, consultations and therapies for low-income families. Videos that I do, it's for post-operative for patients, because people have surgeries like hip replacement, bypass surgeries, and they don't know what they can do or cannot do except that specific part that they operated. So the videos help to move entire body within the precautions, post-operative precautions, and help them move pretty much head to toes without being afraid to cause any damage after surgeries. Do you have any questions for me?
I think Trudy has given me permission. Trudy has improved quite a bit since we came and talked to you. Can you describe how you diagnosed what was the issue with her? She had a hip and groin issue.
If Trudy gives me the permission to do so.
She did.
Okay, so I rely on to my hands a lot, obviously. So I learned throughout the years, I had great mentors to feel the body, to feel the tissue, how healthy tissue feels, how stressed out tissue feels, how damaged tissue feels. So by basically, I call it reading a language, knowing the language of the body through my hands. And when I feel the body, I feel what's going on within the body and what condition it is, what kind of approach it needs. Because doing special tests is something that most physical therapists do, but everybody's body is different. And you can do the test. The test is not going to give you as much information as actually feeling what's going on within the joints, muscles, ligaments, fascia, even the skin itself. So I really do, basically on the first visit, I kind of get to know the people's body first. And when I look at the problem, I don't look just if you come in with the knee or like Trudy came with the hip. I look at the entire body and to see what caused certain part of the body to fail. Because a lot of times it's not the part of the body itself starts failing. There is a cause to it. And that cause can be accumulation of multiple issues in the body. And when you find them and put them together, you can come up with a better treatment plan. And the most efficiently, a lot of times people blame their problems on age. And they say, oh, that's how I have to live because I'm already 80. And I do not follow that philosophy. This is a wrong philosophy. No matter how old you are, you can always improve. You can always get better. Age is just an excuse, pretty much. And if you look into the body, if you'll see what stops body from healthy function, you can help it to get better. You're going to eliminate the cause of it. Unfortunately, it doesn't happen fast. It takes sometimes months, but you basically, in a way, it's probably not very accurate to say, but you're helping to rejuvenate the body. Because when there is no pain, the body can function better. You have more energy. If you have pain, your body constantly uses the energy to deal with pain. And the more you use energy to deal with pain, the less energy you have for other things that you can enjoy in your life. Or pain starts like a spider web, dragging other parts of your body into the problem. And you don't notice how you becoming sideways or leaning forward or limping all the time or having your knees not all the way straight because it's a slow process. So that's with Trudy, we looked at the whole body, we saw what causes it and slowly progressed to improve and create also exercise program, which is important, creating exercise program that's specific for that person's problem. And people are responsible doing those exercises. So our goal is to bring patients to office not to exercise. We teach them to exercise properly, but their responsibility to do it on an everyday basis at home. Because I believe people don't need to go to somewhere to exercise and pay for that. As long as you learn how to exercise properly, you can do it on your own. You come here for our hands, primarily something that you can't get anywhere or you can't get home yourself. That's the expertise and the hands that we do remodeling. In a way, we remodel sometimes the body in order for it to function better and healthier.
That reminds me of what you're doing with me, which is I had a shoulder issue and I went to an orthopedic surgeon and he explained to me that I had a couple of things wrong, arthritis, calcium leaching from the bones, and that he, of course, could give me a new shoulder, but he recommended against it. And then I came to you and I got this very very probing and direct physical examination of my shoulder and neck and back. And do you remember any of that, or is that just a...
Absolutely. Absolutely.
So how did you go about figuring out what was wrong with me and then attempting to fix it, which is going very well?
It's like a jigsaw puzzle. So taking your neck, your back, everything. So it's not the shoulder, everything connects in the body. We have muscles that run into shoulders from our lower back. We have muscles that run into shoulder from our chest. So it's not just the shoulder up here. So you have to look at to everything that comes into that part of the body. And in order to understand that, I had to look into your neck, into your lower back, and to your chest to see how many involvements were affected coming into your shoulder. And once we looked at that, we figured out what was affecting the shoulder, and that's why we had to go into your neck and partially into your back as well to help your shoulder. So again, it's and a lot of it's observing how body works. When I looked, I see how they contract, how muscles contract, how much space within the joint. When I play with the joints, I feel how much space is in there, and partially how difficult I am moving those joints. That tells me all the information, what's going on within the body.
Right. And my shoulder has changed quite a bit. As you know, you can see when I walk around.
Yes. Your posture has changed also.
Right, right.
Because your body is able to be more upright, more proud when it doesn't have as much pain.
Right.
And sometimes when you have a very long lasting problem, you need, I call it 2-3 vacations. That means you get a treatment for a month or two, then you get a vacation for a few weeks to let the body to digest what happened to it. And then you come back and we push you to a second stage to improve again. And once you plateau, you need to have again a break of 3-4 weeks in order for body to understand what happened to it, to get used to this. Because when the changes, the generative changes happen, they happen slowly, much slower than when we work on it. So whatever we accomplish in the month, it means in the body it was going on for at least a year. So the changes that happen within the year, then we change within the month. So the body needs to process that, to memorize that new condition in a way, or to remember it again. So when you get 3-4 weeks break from us, your body settles in the new condition, then we're able to push it further. Sometimes they have to go into those like galloping type of treatment. Any other question?
It sounds like Peter was very fortunate to have a surgeon who said, I could operate, but I don't recommend it, and instead came to you. Does that often happen, that you find that people really don't need surgery if they do the proper exercise and they get treatment from you?
So I do get, once I got to know doctors, or let's put it this way, once doctors in New Jersey got to know me and trust me, so they more leaning to send them to me first before going into surgery. Mm-hmm. It was very difficult in the beginning. I must say I faced a lot of challenge in the beginning because New York doctors in general practice slightly different than New Jersey doctors. And I'll explain to you, for example, in New York, and maybe because I had long relationship already with doctors, they trusted me, so it was easier. But I know in New York, primary care doctor, for example, if you come to primary care doctor and you say my shoulder hurts, he says, okay, here's a prescription, go to physical therapy. In the meantime, go to orthopedist, do whatever the orthopedist says, but in the meantime, have your therapy and see how you do. In New Jersey, primary care says, no, 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 no therapy, you're too acute or too chronic, go to orthopedist. So by the time patient goes to orthopedist, gets MRI, it's another few months passes. By the time person gets to me, they're much worse, especially if it was acute problem. So once I've developed a relationship with doctors who kind of in the beginning, it happened that they sent people to me because they were like a soccer ball. Nobody wanted them anymore. They didn't know what else to do with them. So just go there, see what happens. So once they saw that people improved, they had results, they started to lean more towards conservative. I have a good number of doctors that now, including Peter's doctor, who now willing more to try conservative to help patients first through physical therapy, as opposed to taking them right away to surgery.
Yeah. You know, Irina, the part that really worries me is not just when a physician sends someone for physical therapy, but the part that worries me are the number of prescriptions for opiate pain relievers that oftentimes put people in great jeopardy, because they do get hooked in a very short period of time.
Yes, that's absolutely, it's a very good point. But like I said, it was, for me, it was an adjustment to New Jersey's way of practice. And I know a lot of times that even patients that already know us, know the practice, whenever something acute happens, they know they'll come in here right away. And I tell them, go to your doctor in the meantime, get whatever they want you to get, MRI, this. When we practice, I always keep in mind, as a doctor probably, you know, to make sure it's nothing systemic. So we want to, when I suspect something systemic, we always want to rule that out. So you never assume that it's just neuromuscular, musculoskeletal, that it's something that's physical therapy. Have to always make sure that there's nothing else is involved. And Peter, Peter can actually tell about that example when before doing work, we wanted to make sure his heart is okay.
Right.
The symptoms that were presented, they're very similar to cardiac symptoms. So before starting the program to improve the endurance or the strength, we wanted to make sure there's nothing going on in the cardiac perspective. Once we were cleared, we can develop the program further and help better. Right, Peter?
Absolutely. I went to a very good cardiologist and got an intensive screening up in Morristown, and he gave me, fortunately for me, a clean bill of health.
Mr. Dietz. Mr. Dietz has a question, but he's gone mute. There you go.
Yeah, so I'm here. So thank you for doing the presentation. I'm a big fan of physical therapy. I've had it for several issues and so forth. How do people pay for your services? Is it all covered by insurance? We were talking about Medicare before. Is it covered by Medicare? What percentage of people just pay out of their own pocket? Thank you.
Usually the people who pay out of their pocket is the ones either who don't have insurances, or they pay because they have high deductibles. Some private insurances have deductibles that are very high. And then they have to pay for a visit because their payments go towards the deductible. So basically, everybody who has insurances, we take major insurances. Medicare pays for physical therapy based on medical necessity, which means every 10 visits, I submit the progress report on the patient. And if Medicare, it's called functional scale report. So if Medicare says that the patient makes the progress within certain scale, then they pay for it. And if they see the patient doesn't make progress, that's why what happens in a lot of clinics, they tell patient who's Medicare, you only have 12 visits, which is not true. If the patient, of course, came for 12 visits and he made very little progress, 5% progress, yeah, Medicare is not going to pay them. And if practice knows that they're not going to make sufficient progress, then after 12 visits, Medicare will not pay. So they tell them, oh, they only pay 12 visits, which is not true. It's really based on how much we help the patient. And if Medicare sees, for today, as a matter of fact, when Trump became president, he took off the hard cap. Because Obama put on Medicare a hard cap for physical therapy. It means after 3,000, that's it, nothing you could do. No matter how sick you are, Medicare wouldn't pay for it. The first thing which Trump did, he took off the hard cap, which became soft cap. That means you have to show how the patient is doing. You have to show their progress in order to get reimbursed. Did I answer the question about the payment?
Yeah.
It was very interesting, your response. I appreciate it. Thank you.
I'd like to ask a follow-up to that. How do you measure progress? Isn't that a tough thing to report back to an insurance company?
So it's tough with, it's really difficult with private insurances. Because unfortunately, private insurances, they do not pay if your pain is 5 out of 10. They consider that's a pain that can be managed by Advil, Tylenol, Motrin, and similar medications. So they consider it functional pain. Medicare does not consider that. So Medicare looks into pain and function. So if you are not able to put your jacket on because you have shoulder pain today, and tomorrow you are able to put a jacket on, that's a functional achievement. So Medicare says you're making a progress. And if now you're not just putting your jacket, 10 visits later, you're able to lift your arm up and lift something from the medium shell. That's a progress.
Right.
So with Medicare, it's much easier. And
so I guess both Medicare and the private both look at your notes in order to determine progress.
So there is, no, we do, Medicare has, it's called, like I said, it's called function vibe. So it's, since we use all computerized, it's no longer paper notes. It's a notes that in cloud, which Medicare, they have to be, those programs have to be approved by Medicare. So Medicare has constant access. They can always go into my notes and check them. So, and there is such a test that Medicare requires, it's called function wipe, which is functional reporting test. So every 10 visits, I answer the question in that reporting. That's why I ask every visit, I ask patients how they feel, what they are able to do. I know sometimes they get annoyed with me, but I need to get all that information. And they say, oh, I don't like to complain. This is not complaining, it's collecting information, which helps me understand better how you are doing and what we need to work on. So that functional test, when I answer the questions, I don't see the score. Score goes directly to Medicare. And Medicare determines, according to that score, how we're doing.
I had a question. I'm just going back a little bit. Do you actually need a doctor's prescription in the first place, or can you just, somebody just come into you and say, I have this pain and I would like to, see if physical therapy will help?
So if it's a private insurance, most of them, I don't really need a prescription unless I need prior authorization. So for the insurance that you need prior authorization, I prefer to have prescription. For Medicare, I do not need prescription for evaluation. And I have people who come in to me, like they call it for the interview. They want me to evaluate them first before they go to doctor and get a prescription. Because again, you have to remember, we're a small practice. We're not a part of big system. And if patient has a primary care who is Atlantic group or Summit group, they want that patient to go within their system. So a lot of times patients have to be very firm by saying, I am not going to Atlantic healthcare across the street. I want to go to Central Physical Therapy. They have to be really firm sometimes and get the message to their doctors that they want to come to me.
But I guess I didn't catch it. So you said for Medicare that you do not need a prescription, or do you?
For evaluation, I do not need a prescription, but for treatment, you do. Medicare requires to have a doctor's prescription on file.
Okay. Thank you.
I have a question.
Just give me 1 second. Start ultrasound. Start ultrasound. Yes, on the neck, on both sides, 6 minutes, 1 and 200%. I'm sorry, I already have a. Yeah.
You're working and talking.
Sorry.
I'm at an age where many of my friends are having artificial knees and artificial hips. And I was wondering, just in a broad sense, if you think that this is an overprescribed, just on average, do you think that out of 100 artificial knees that are put in patients, are 90% of them necessary, or maybe only 40%? Do you have an estimate, a guess?
So I must say it depends on orthopedist. I know orthopedists who over, and there are orthopedists who are actually right on the dot. So it really depends on the doctor. And that's why I have a list of good doctors and list of no doctors, no to go. So at the least, I always, if I don't know a doctor, I suggest a patient, and I feel myself that I think it's a little too early for surgery, especially if the person is 50 years old. You don't want to have a hip replacement when you're 50. So I always suggest to go to doctors who I know are right on the dot, who will not operate unless it's necessary. So it really depends on the doctor. And I must say there are more good doctors who are right on the dot, and there are much less doctors who are just doing because he's an orthopedist.
Good to know.
So there is no clear percentage, but there are less doctors like that, definitely. More doctors who do it because it's time to do it. And think also about it. Humans never live that long. So people's lifespan was 40 years, 100 years ago. So people never used their joints for such a long time. And the fact that people have knees replacement and hip replacements at age of 70s and 80s, it's just not surprising because people didn't really take care of themselves when they're young. It was not in culture to go to gym, to stretch, to do yoga. People worked. So they abused their bodies. And at a certain point, they start failing. So seeing the fact that you see knees and hip replacements, it doesn't surprise me. So it's going to be hopefully much less with generations who are now 30s, because they are much more conscious about taking care of themselves.
Do you recommend walking as an exercise in general?
Walking is a form of exercise, but it's not an exercise that's going to keep your joints healthy. To keep your joints healthy, you have to stretch more, like Pilates, yoga, those kind of activities. They help you to keep your joints healthy.
Yeah, thank you.
You're welcome. So if you have yoga nearby, I suggest you get involved with it.
I'm a skier. Do you endorse that, or do you frown against that?
What?
I like skiing. Is that a problem?
No, it's not a problem. I just always recommend any activity you do, stretch before and stretch after. And I create for athletes, I work with golfers, swimmers, tennis players, and I create a stretch program, skiers the same way. That's more beneficial for that type of sport. And I recommend people to do that before and after the activity to prevent the injury. So skiing is good. It's a fresh air. Did it help to answer the question?
Yes, it was right on the money. Thank you.
Okay. So I have, if you don't mind, I have 3 more minutes and I have to go to my patient. Since we see everybody on time, nobody gets delayed. Their time of appointment is the time when I see them in the room. So I don't want to break that rule.
One quick question. Hopefully, chiropractors. I mean, what would you go to when would you go to a physical therapist versus a chiropractor?
It depends on the chiropractor and depends on the physical therapist. I have 3 chiropractors that I work with. They are fabulous. They know their limitations and they refer patients to me. If I choose a good physical therapist, I would always choose a good physical therapist to a chiropractor. But if I know a chiropractor that I know those chiropractors, they don't do direct manipulations. A smart chiropractor never does direct manipulations. Let's put it this way. So if you go to a chiropractor and he doesn't start cracking you, so he's probably a good one. But I would personally choose a physical therapy. But you can get a bad physical therapist and better chiropractor. It's very individual.
One thing I'd like to say thank you on behalf of the New Providence Summit Rotary. You were very helpful, and I think the answers and the time you gave us was well appreciated. So thank you again.